Romania, Ukraine, the Republic of Moldova, the Republic of Belarus, and the Republic of Bulgaria. I'm Simo, and this is Furkan. We would like to greet you with the warmest welcome from the Republic of Bulgaria. We are all here together to mark World Health Day, which is annually celebrated on the 7th of April. The celebration has aimed to raise awareness about a specific health theme, to highlight a priority area of concern for the World Health Organization since 1948. It is marked by activities that extend beyond the day itself and serves as an opportunity to focus worldwide attention on the important aspects of global health.
This year, the World Health Organization is calling for action on building a fairer and healthier world. To begin with, we appreciate that Ms. Maria Marinuța, an activist in women and children rights and environment protection, volunteer, local councillor, pediatrician, recently an English teacher from the Republic of Moldova, accepted our invitation, and she is here to share her ideas with us. Yes, Ms. Marinuța, please.
Hello, dear participants. I'm really glad to hear all your insights about a healthy lifestyle because all of you are young, and this is very important to keep an eye on the healthy lifestyle from the younger years. And I just want to hear to your opinion and maybe tell you what is interesting for you to hear from me. Thank you for invitation. I can't hear anything. Sorry, I think your sound is off.
Okay. It's our pleasure. Well, would you like to add anything else so we could continue? If not,
we could continue, and then on the specific topic, I will talk about my insights.
Okay. So we continue. As we have said, this year's topic is building a fairer and healthier world. Let's now hear the interviews with a few medical personnel from Bulgaria. I believe that each one of them points out some important and essential information.
Че ни приехте поканата за интервю. Днес ще се засегне април, Световен ден на здравето. Всяка година Световната здравна организация избира тема. Тази година темата е изграждане на по-справедлив и по-здравословен живот. Вие какво бихте ни споделили свързано с темата? И как може да се изгради такъв начин на живот?
Здравословният начин на живот се състои от много фактори. Основно физическото състояние, психическото състояние е повлияно от, специално за психическото състояние, е повлияно от пандемията коронавирус инфекция. Що се касае до здравословния начин на живот, тук участва и храненето. Храненето трябва да бъде хранителният рацион на децата и на възрастните, трябва да бъде съобразен с много фактори, от които се повлиява организма. Другото, което е застоялия начин на живот. Също много важно нещо за формиране на здравето на човека. Трябва да има активна физическа дейност, излизане навън, колкото се може повече, Редукция стоенето пред компютъра. Най-вече това, защото се наблюдава и при децата, и при възрастите заболявания, които са доста така съвременни, с едно главоболие и не само главоболие, и общо повлияване на скелета на човека и така нататък, което е много важно. Храненето също. Храненето се не случайно има наредба определени храни да не се пускат в училищните столове, в бюфетите и така нататък.
Как коронавирусът повлия на работата ви? По какъв начин промени вашия живот?
Влиянието на коронавируса върху цялото общество е много голям. Промяна в подхода към пациентите като цяло. Дезинфекция, което това са стандартни неща, които трябва постоянно да се спазват и да няма отстъпление от нито пунктовете, които са регламентирани от Здравното министерство. Освен дезинфекцията бива няколко вида: химична, ултравиолетови лампи, премедикация на пациента с отделни разтвори преди да се започне работа, защитно облекло и така нататък. И винаги има едно предпазване, което трябва да се спазва и от двете страни, задължително, защото иначе нещата са реципрочни са. Както пациента може да зарази лекаря или лекаря по дентална медицина, така и лекаря по дентална медицина и респективно лекаря може да заразят и пациента. Що се отнася до психическото състояние на хората, има едно натоварване на психиката, което с повече усилия и трябва да бъде преодоляна, за да може да преминем колкото е възможно по-леко през цялата инфекция. Да се надяваме, че скоро ще приключи.
Благодарим ви за споделената информация. Приятен ден и успешна работа.
Благодаря и на вас. И основното нещо по време на коронавирусната инфекция е дисциплина и пак дисциплина и спазване на всички противоепидемиологични мерки. Благодаря.
Доктор Мутишев, благодарим ви, че откликнахте на нашата покана. Тази година и голяма част от миналата година минава под влиянието на коронавируса. От вашата гледна точка, като специалист, като психиатър, коронавируса как повлия на хората, на техния живот?
Най-общо можем да кажем, че коронавируса представлява един голям стрес за хората, като по различен начин се отразява според възрастовата група, според това дали има съпътстващи заболявания хората, според това на какво ниво на зрялост се намират. Но смятам, че по някакъв начин са засегнати от пандемията, са засегнати младите хора, децата и юношите, тъй като те са в един процес на развитие, на изграждане, на възпитание и лишаването им от тези контакти в училище, лишаване на контактите помежду им, това по някакъв начин допринася за това някакси да останат някакви дефицити, които в последствие трудно могат да бъдат възстановени. Разбира се, по същия начин се отразява негативно и на хората, които имат съпътстващи заболявания, материални затруднения, те също тежко преживяват. Все пак можем да кажем, че има и нещо хубаво от коронавируса. Това е, че по някакъв начин стопира хората, една част от хората да могат да се замислят върху това какъв начин на живота водят, какви позитиви могат да извлекат, някаква равносметка за себе си, да се обърнат към по-екзистенциалните въпроси, които ги засягат.
Благодарим ви. За първи път един от специалистите ни показва хубавата част на коронавируса. Тази година Световната здравна организация прие мотото изграждане на по-справедлив и по-здравословен живот. Относно тази цел, имате ли препоръки и предложения?
В зависимост от това дали в международен план ще погледнем на нещата или в национален, смятам, че един от важните въпроси е до достъпа до здравеопазване. Тъй като здравните системи са част от фундамента на обществата, а пък здравето като част от фундамента на личността, изключително важно е белег на цивилизованост е, когато хората имат равен достъп до това да имат достъп до здравната система. От друга страна е много интересно това, че достъпа до здравната система струва на обществата по-евтино като разходи като цяло.
Много ви благодарим, доктор Мутишев. Беше чест.
За мен също беше удоволствие. Благодаря.
В здравеопазването най-важното е, разбира се, и лечението, но най-важното е профилактиката. Какво означава профилактика? Това означава всички мерки навсякъде, които са свързани с нашето здраве, да бъдат насочени на това да не ни се случват тези болести. И точно това е. Ето сега, както примерно при коронакризата, предпазните противоепидемичните мерки, дистанция, профилактика, дезинфекция, вакцинацията, ваксините преди коронавируса, това беше. И елементарно миенето на ръцете, личната хигиена, здравословното хранене. А за това нещо също е много важно, като отбелязваме това, като говорихме за по-бедните държави. Трябва да има здравословно хранене. Това влиза също в това нещо. Но то пък се определя от това с какъв ресурс разполагат държавите. По-бедни, по-богати. И идеята е такава. По-богатите да помагат на по-бедните. Да си взаимодействат. Независимо от коя точка на земното кълбо е. Тези, които са по-богати, и то не е само по-богати финансово, значи могат да бъдат по-богати от към информация, в науката, може да са на много по-други нива, защото има държави, в които, например, са абсолютно неизвестни някои лекарства. И ако не сме ние европейците, или примерно в Англия, Америка, знаете, има много, може би сте чули, то не е задължително да знаете. Има много научни институти, които са насочили своята дейност само единствено към това нещо. Да помагат на тези държави да се развиват и да вървят нагоре, за да може в целия свят хората да бъдат равнопоставени и да бъдат еднакво здрави. Трудно е, но не е невъзможно.
We think and believe that the previous discussion forums were of great help in many aspects for all the participants and guests as well, and we hope that this one will be so too. Let me introduce all our participants to you. We would like to apologize in advance if we mispronounce your names. From the Republic of Moldova, we have Nicoleta Seretina, Roxana Mehriarad, Francesca Talmaci, Karina Dilsis, Irina Deli, Stefan Gorgos, and Dan Celevestru.
From Romania, we have Breana Sara Stefania, Cinaro Bianca Isabel, Zamfirescu Ioana Miron, and Zaharia Antonia Maria.
From Ukraine, Maneta Kaur, Marian Nakashivtse, Maria Hercik, Arvin Kaur, Hafsa Erdoğdu, Elina Zelenina, and Bushra Demir.
And from the Republic of Belarus, we have Yusuf Chakmak.
And lastly, from Bulgaria, Yana Nasan, Sara Chitakova, and Sian Tihumir Takarov. With your contribution and active participation, we hope to have an insightful and enjoyable time together. Before we set off with the discussion, we would like to remind you, the forum participants, to keep your cameras on at all times, to keep your speech not longer than 5 minutes, and not to forget to add your country codes before your names as shown on the screen. Please feel free to join or make comments anytime you wish. If we're all set, I'd like to ask the first question to Romania, which is, are all people able to access equal and quality healthcare services in your country?
Hello, my name is Ioana Zafirescu, and I'm the delegate of Romania. So I would like to start by saying that no, not all people are able to access equal and quality healthcare services in Romania, despite the fact that authorities claim otherwise. While the state healthcare system covers the basic medical expenses for people under 18 years old, unemployed and retired population, and some categories of socially assisted persons, the rest of the population, example, unemployed population over 18 years old, needs to pay in order to benefit from medical services. Therefore, the level of access varies depending on the population's financial possibilities. The living environment is a factor to be considered also due to differences between rural and urban areas. The lack of medical technology for investigations and treatment, damaged medical units, informal payment to doctors have also a negative influence on the quality and fairness of healthcare services. Thank you.
Thank you. Okay, anybody else who would like to join from another country?
Yeah, I would like to add.
Would like to hear participants from other countries?
Yes.
Do we have any volunteers?
Excuse me, can I answer?
Sorry. Okay.
Can I?
Yes, please.
Okay, my name is Deli Irina. I represent Moldova. I would like to say that in my country, in Moldova, it is very vital and very important to have health insurance. We call it here a polis in Moldova. It allows you to have access to doctor appointments for free and have received certain sales when it comes to making medical examinations, or in some cases, it gives you a chance to get tested without any charges. Usually it works with blood tests only. Elderly people in Moldova buy medications in pharmacies with a big discount because of health insurance that I have paid for. It costs around 4,000 a place, which is pricey because it is $200, I think. Not everyone is able to afford it, and there are a lot of disadvantages of not possessing it. You need to pay for doctor appointments every time if you do not have this policy. As I said, usually doctors charge 200 lei per one session. It is $11. Also, a person without a health insurance won't get a chance to stay at a hospital without having to pay for his treatment or for a room where he is staying. Basically, medical insurance, it allows you not to pay for anything, although you have to pay for a medical insurance. I think that not everyone is able to access equal and quality healthcare services in Moldova, since not all the Moldovan people have the money to buy this insurance, the policies I said, and not all the doctors are willing to help their patients. I'm not blaming the doctors at all. Not all family doctors give their patients the referral for passing certain medical examinations, for example. Not all the doctors are fair and diligent, but the problem is not in doctors or in people. The problem is in the poverty of my country, is in the system of my country, I would say.
Thank you, Irina. Okay, anybody from another country?
I want to say something.
Yes, please, Sarah.
First, my name is Sarah. I'm 18 years old and I'm from Sofia, the capital of Bulgaria. So for my country, I want to say that most of the hospitals and doctors are in big cities. And actually, it's quite logical because most of the people live in big cities, especially in the capital. 1/3 of the population of Bulgaria live in Sofia. But it doesn't mean that people living in small regions, in small villages, don't deserve good healthcare. They deserve it, and something has to be done. And do you know what is the worst in this situation? The worst is that we have accepted. We think it's normal. We think that this inequality is something normal and we don't do anything. If we sometimes to find the solution, first you have to see the problem. And in this case, if everybody try together, not only politicians and governments, if everybody try to change it, it'll happen. And that's me.
Okay, thank you. Thank you very much. Anybody else who would like to talk about?
I would like to talk about Ukraine, Ukrainian healthcare system. First of all, not everybody can access to healthcare in Ukraine. And even if you can access to the healthcare of your, let's say, region or your country, city, the hospitals are very old, they're unhygienic, and they need a lot of improvement. The workers, like the nurses, the doctors, they have very low, they get very low payment, and that's why the hospitals are very outdated and they lack medicine and the healthcare they have to provide. So basically, even if you access the healthcare services, you won't be able to get a good one.
Okay, is there anybody else who would like to say? We can move on to the next question.
My name is Jan. I'm from Bulgaria. I'm 18 years old. I want to add something from my personal opinion. I don't know if everyone knows what Hippocratic Oath means, but for those that don't know, I'm going to explain it. It is something that when a doctor finishes his or her degree, they promise that they will never ever decline treatment to anyone. But for Bulgaria, I can say that I have seen not once treatment being denied. And the sad thing is that it is denied to the elderly people. And as we know, Bulgaria is one of the countries that has a very big percentage of elderly people from the whole country. And if we don't look properly after them, the worst will come. And in terms of equality, I can say that, for example, a young person comes to the hospital, treatment to him won't be denied rather than an older person. That's all.
Okay, thank you. So we see that inequalities stem from personal basis or sometimes institutional. So the next question is actually related to inequalities. So we see that there are many inequalities in the world, especially in terms of healthcare. While this is unfair, it is preventable. So what do you think are the root causes for these inequalities? Why do you think they exist?
Can I answer?
Can I start?
Yes, please.
You go first.
Thank you. So, people of color and low-income individuals, they historically have faced greater barriers, and not only in accessing healthcare, but comparing to whites and those at higher incomes. We all know that such countries or such regions, I would say, as Liberia and Nigeria and Estonia and Nia. So they're facing that problem every day, I would guess. So and the roots or and social. So as we can see, that is a problem, and we have to deal with that.
Okay. Thank you, Karina. Thank you, Karina. From Moldova. Okay. Anybody else to talk about inequalities?
Can I continue?
Okay, you go. Sorry.
Yes, Liana, would like to add something?
Yeah, I would like to add to Karina's speech a little bit. Inequalities happen due to our social differences, I think, such as employment. Many people in Moldova are poor and even homeless, I would say. It depends on education as well. Some people aren't able to get a university degree because they are not able to pay for tuition fee in Moldova. And they start working, their salary is low, and they barely make ends meet. And how do you think they will pay for health insurance to get these healthcare services that they need to have? How will they pay for drugs that their doctors prescribe them? Some people are disabled and it is hard for them to go to hospitals. Some hospitals do not even have special stairs for disabled people. It's a huge disadvantage, I would say. Basically, Moldovan healthcare system is good for people who have a well-paying job, I would say. Healthcare system doesn't care about homeless people, poor people, some disabled people, unless they have money. At least that's how it is in Moldova, I would say.
Yes, the same applies to Bulgaria. If you can't cover insurance, you can't really profit or benefit from the people who already pay their insurance. And the way it works in Bulgaria, at least, is people who pay insurance also have also pay for people who can't pay for themselves. For example, disabled people. It's the solidarity system, and people who can't cover insurance don't get to be a part of that.
Thank you, Liana. Anybody else who would like to talk about inequalities?
I want to say something.
Yes.
A few people mentioned education as a way to get money, to become rich, to pay your insurance. But I think that education is also very important to understand that medicine is something very important, because educated people know the importance of science, the importance of doctors. They invest in them and they care about them. And also another root cause of this problem with inequality is geography, in my opinion. What I mean, for example, some people who are living in high mountains or in deserts, let's say, or on islands, they have difficulties with their access to healthcare. And maybe we can say economy is one of the most important factors, because countries with better economical development have better health systems.
Yes, financial status of the country. Okay. If there is no other country who would like to talk about inequalities?
A few words.
Yes, of course, Ms. Marinska.
As Sarah said, the economic issue is very important. We know that all the inequalities are coming from the economical levels of different countries. And the smaller the gap between the richest and the poorest is in a nation, then the better the healthcare system and the better the well-being of people living in that country. We know that we are all different. We all have different expectations from the life, from our goals, and from our countries as well. But still, the right to the health care, it's an important one, and it should be respected in all the countries. Now, as somebody mentioned about the Hippocratic oath, it is very important. And yes, the doctors don't have the right to deny the treatment to any patient, being it an elderly or young or disabled. Everyone needs to have the treatment in the right conditions and approaches. Well, in different countries, doctors are part of the society, and if they are not well paid, like in very poor countries, then they have different challenges in their life as well. And I know it's not right to say that somebody has the right to deny, but they don't do it on purpose. Perhaps it is the way they live their own life. It is very sad to hear that some elderly people or some people with different types of disability, they don't have the right to be treated. And as I mentioned, everything from the life expectancy to the infant mortality and obesity, everything can be linked to the level of economic inequality within the given country. And further, if we go, inequality reduces social cohesion. This is a dynamic that leads to more stress, more fear, and more insecurity for everyone living in that country. And this comes to a vicious cycle. More fear, more anxiety lead to poor healthcare and well-being. We will perhaps speak about COVID-19 because it's happening today in the world. And I remember myself during the first days of the pandemic in March last year, I was following all the numbers every day, a few times per day, which is not a good for my mental health, and for that reason, for mental health of the population, because this surges the anxiety. We will see a surge in the mental disorders, as is anxiety, major depressive disorder, and bipolar disorder, which are already on a big rise. We have to take care of ourselves and perhaps maybe consume a little bit, not to overdose the news, I would say, I don't know. I remember myself when I saw the numbers grow to 1 million, and now we have 137 million cases, which is very big numbers to imagine. For example, in Romania, we already have over 1 million, and this was a year ago overall in the world. Now our country, our neighboring country, has this number. Ukraine has 2 million cases, which is very impressive on the human, especially on the young brains, to say. Well, thank you. I will.
Thank you so much, Ms. Marinica. Judging from what everyone said, I think it's high time we call for action. What can be done to build a fairer and healthier world for everyone?
Well, what can be done?
In my opinion, we should get governments to invest more money into the people in healthcare facilities specifically, because countries that are not so well off usually invest in becoming well off, and that's not a bad thing. But once they become well off, they tend to lose focus of becoming good for the people, and they just become good for themselves.
Thank you.
Thank you. This is what the government could do. Okay, thank you. Anybody else?
Yeah, can I add?
Yes, please.
So I think that every person deserves to live in a healthy life, regardless of their age, gender, disability, income, or social status, maybe. There are many countries that are currently experiencing emergencies, and unfortunately, one of these countries is Moldova. If there is a chance to improve the situation, people should address the government, I think, like government leaders, to ensure that all people have equal access to the quality health care, regardless of age, income, and maybe type of disease or whatever it is.
Can I add?
Yes, please.
And I think I agree with Karina fully. I would like to say that in order to maintain equality in healthcare services, we have to address the leaders, as the previous girl says, to monitor health disparities and ensure that all people have equal access to the best medical care standard, regardless of their age, origin, lifestyle, or type of disease, as was said. Yeah.
Okay, again, this is something that government should do.
Yes.
Anybody else? Any other opinions?
Yeah. Well, you can talk
Bushra from Ukraine.
Thank you. Yeah, from Ukraine. I mean, judging from Ukraine's situation, right now everything is like every bad thing is happening at the same time. Of course, one of the biggest issues is connected with the economy of the country. But the second is that coronavirus has had a huge impact on the world and on our country right now, and people cannot get the same treatment because first of all, government Ukraine has a lot of debts and they don't have enough money to cover it. Plus, one of the biggest issues is that we don't have enough buildings, like enough hospitals, not even doctors, enough hospitals to fit in the people who are sick. But I think that, which is actually very hard, but it is of course possible. With the cooperation of the whole country, everything could become better because people here don't care about coronavirus and about this situation right now. No one cares about wearing masks or keeping distance. And so I think if first of all people get their hands into their heads and they start thinking straight, and if government does its best to cover their debts and build new buildings and hire more qualified doctors, I think that would be one of the best situations. And one more thing is that right now, because of the situation that there are not enough hospitals, people have to make sacrifices of other people. Like, for example, in a hospital, when it comes to saving a person who is elderly with COVID and who is younger, they usually choose the person who is younger, regardless of this situation, because they think that the old person is going to leave us sooner anyways. So I think these sacrifices are a very huge thing because people's lives are really important. And if the situation doesn't get better sooner, it will end up very bad.
Thank you. Thank you, Bushra. I think Dan had to say something, if I'm not mistaken.
Yeah. Hello. So what I wanted to add is, of course, let's start with education, especially the new generation. Like telling our younger teens, kids, etc., that the health, our health means a lot, is really important. It should start from the young age, of course. So the first thing would be, to start having more events related to healthcare, have more, advertisements on the internet everywhere. And that's the first step. Second would be, I would say it can go either way. First would be for our government to invest more funds in the public system. And I would say firstly in our doctors and people who work in the medicine area to have higher wages, because being appreciated at work is really important. And if the person feels appreciated, they're gonna work a lot harder, and it means it's gonna help the whole country, and etc. Also, in the infrastructure, the more developed it is, the easier it's gonna be to treat people, and it will be more time efficient and maybe cost efficient too. Our path would be to increase the wages of all the people across the country, so they can be able to pay for the private department of healthcare. In my country, Moldova, our private sector is a lot more well developed because the most of the best specialists in our country go for the private one because, yeah, it's logical. You're getting paid a lot more, and I guess the appreciation level. So yeah, I think these are the things we should do to develop.
Okay.
Thanks.
May I also add something, please?
Yes, please, Joanna.
Thank you. As stated in the European Patients Forum, health is a fundamental right. Every person deserves to live a healthy life regardless of their age, gender, ethnicity, disability, economic situation, or employment. Therefore, I believe that developing the infrastructure, building more hospitals in the rural and unprivileged areas, and also renovating the current medical centers would definitely have a huge impact upon the healthcare system. Ensuring an increased quality of medical services can be achieved by ensuring the necessary material resources, medicines, equipment, apparatus, as well as the necessary qualified personnel and the appropriate financing for the development of medical activities. Thank you.
Thank you. Okay, so we see that somehow financial problem is of great importance, and also we see that somehow the healthcare should be integrated in the educational system. So these are very important basic reasons and areas where we can work on. Thank you for that. And now there is another different question. We hope that governments and related institutions hear your comments, and we hope that we all will take the necessary actions to make some change because we all need it. So the next question, the fourth question of the first part, and the last question is, could you please tell us something about the common diseases in your country? Why do you think they are so common? What are those diseases that are common in your countries? Could you please name them quickly, shortly?
Okay, can I talk? Yeah. So in my country, Moldova, I would say the most, how do you call it? The cases of the diseases would be like heart disease, or how they're called, cardiovascular. Yeah. Second of all, there would be cancer. Yeah, in Moldova and in other countries, even in Romania, from what I know, cancer is still a very big factor of death also. And in my country, I would say liver problems. Like these are like three most well-known diseases in my country.
Mm-hmm. Thank you.
Can I add?
Yes, please.
As the person said before, the popular, I would say, diseases in Moldova are heart diseases, everything that is linked with heart, cancer. I would like to say diabetes is also a big issue, tuberculosis, to illnesses of the thyroid gland, kidney stones, hepatitis, and liver cirrhosis, and many others, but they are not so popular, not an issue now at the moment. Most of them occur due to the lifestyle that our people follow. They might consume drugs, although I think that drugs are not a big issue in Moldova, but some people still do it. They might drink alcoholic beverages without thinking a lot about the impact that it can give on your health. They might smoke and eat greasy food daily, and they not even understand that it actually affects your health drastically.
Mm-hmm. Okay. Thank you. Anybody else about the most common diseases in their countries?
If I may.
Yes, please.
We are talking about here about communicative and non-communicative how do I say it? I didn't say it correctly. communicable, non-communicable diseases and communicable, the infectious disease and the other diseases, right? Now, non-infectious diseases makes up to seven causes of top 10 causes of death. And I would say this comes from the lack of education of healthy lifestyle habits. Having a healthy life, this means that you have to develop and maintain those healthy habits into your life. Well, because the education lacks on this part of the healthcare, then we do have a lot of non-communicable diseases in Moldova. In Moldova, first three, I would say it makes respiratory disease. This is the first on the first place, the incidence of the respiratory diseases, traumas, and cardiovascular disease. Of course, we have alcoholic consumption. This leads to a lot of liver diseases, and if we speak about infectious diseases, then the hepatitis B, it's a big issue in Moldova as it is in the whole world. I would say that we have to pay attention, to pay big attention to the education of the healthy lifestyle in overall, not only in Moldova, overall in the world. Like, for example, I would say about smoking, just a few words, that smoking in the richest countries are not so big as in the poorest countries. This is happening because people read more about the impact of the smoking and tobacco products on our health, and not only about reading and high education, but also in the poorest country, the advertising of the tobacco products is more stronger, and the presence of the stores that sell these products are more intense than in the richest one. Of course, I would like to say in regarding to the pandemic that nearly 75% of infectious disease are coming from the animals. And this is because maybe because we have a lot of wildfires and a lot of deforestation, wild animals become closer to us, and we will see in the near future other new diseases coming from our interactions with the wild animals, like COVID-19, for example. I would say that if we pay attention to the conditions that this pandemic is telling us to be cautious about all our day-to-day life and respect some elementary hygienic conditions, then we should be a little bit safer. But the economic issue remains the superior one. If the economic issue will be paid enough attention in the whole world, then we will have better healthcare to all levels of the people. Thank you.
Thank you, Ms. Morinuță. It was very insightful, very captivating comments, very important comments for all of us.
Can I add something, please?
Also, other participants from other countries. If there is nothing else.
Hello, I would like to add something.
As we all know.
Or no? Is there anybody else?
Yes, can you hear me?
Yes.
Sorry, I wanted to add something about the common disease in Bulgaria.
Yes,
actually, I read some statistics about the year 2017. And as you may know, in Bulgaria, the people are aging. I mean, Bulgaria has more old people than young people. And the most common disease in old people is diabetes. And alongside with diabetes, we have some cardiovascular problems, some infections, which can lead to very serious problems with the organs. But for example, from cardiovascular diseases, yearly 72,000 people die.
Yearly 70?
For the year 2017, 71,000 people died from cardiovascular diseases.
Okay.
And that's all. Thank you.
As we all know, nowadays, the COVID-19 pandemic probably has the biggest impact on our lives. To appreciate the indescribable and unimaginable effort of the people on the front line, namely all the medical staff, our students have prepared thank you cards, symbolizing our gratefulness for their sacrifice. Let's see what they've done.
Okay. It seems that we can never thank them enough, but at least these cards symbolize something. Thank you for all those who participated in making those cards. And let's continue. Now it's time for the second part. Let's proceed with the second part of our discussion, which is about boosting health, well-being, and prosperity. Oh, but here we have something different. What is this? Let me read it. Interesting. What are we doing here now? Talking about health. Yes, okay. It's necessary to talk about health, definitely, so that we raise awareness. And as we said, we should integrate it into our educational system.
Well, you don't need to always
our
be an expert.
Our question for the second part, if you are all ready, is what is healthy living to you? How would you describe it? Could you give some examples of being healthy and how to enhance physical, mental, and spiritual health? Could you talk about this?
I can say something about that.
Yes, please.
For example, if a person hears about healthy living, the only things that pops up into their mind is doing some physical exercises, eating foods that have less salt, sugars, and fats in it. But actually, for example, if a person is very physically active and being careful what he puts in his mouth in terms of food and some junk stuff. But on the other hand, the person is full with negative emotions. He's not living a healthy life because these negative emotions have a bigger impact on a person's living in general than all these junk foods, not doing physical exercises, staying in one place whole day. And the best part is that you should always be happy because you are alive. and you have what to live for. You have ambitions which you have to chase, and living and chasing your ambitions is the healthy living, in my opinion.
Thank you.
Anybody else to comment?
Yes, I want to add on to Sian's speech about being happy and how negative emotions can manifest as being unhealthy in your life. Aside from being physically active, it shouldn't be a chore to be healthy. You should find something that you like, because if you're doing diet just to achieve something, or if you're doing physical exercise just to achieve something and then stop, if you give up or get to the goal, you just go back to your previous way of life and you won't have any permanent changes. So an important thing of being healthy is finding things that are good for you, like activities, physical activities, and foods that you enjoy, and activities that you enjoy, and healthy food that you enjoy. Maybe even find out if you like cooking, because home cooked meals are also, well, not always healthy, but a good way to start eating healthy. It's a step of the way.
Can I add?
Yes, please.
I absolutely agree with all the people that have expressed their opinion here. I would like to say mine. In my opinion, healthy living means following a healthy lifestyle. It is when a human understands that his physical health matters, since it has a great impact on his mental state, and in reverse, when a person starts to heal his anxious state, panic attacks of different kinds, and different mental traumas, because he gets that he won't be able to be healthy unless he clears his mind. So this one person tries to maintain a certain balance in both his mental and physical state. He consumes many vegetables. He drinks 2 liters of water a day or more. He visits the gym, not just visits, but works out in the gym, stays away from social media. I would say that social media is not always a good thing. Is trying to stay positive and spread positiveness to the world, has a social life, goes out with his friends, keeps in touch with his family members, and in general, enjoys life and helps others to enjoy it. Thank you.
Anybody else?
I would also like to talk about this topic. So healthy living can be described as a state of being in peace with your body and with your spiritual form, your soul. Healthy living is the feeling of accepting who you are, the feeling of accepting your mortal appearance and your eternal form at the same time. To truly enhance your physical, your mental, or spiritual health, you must accept yourself. When you embrace your true nature is the moment when you can rise mentally and spiritually. Some basic examples of healthy living are jogging or walking for 30 minutes a day, drinking at least 1.5 liters of water, hydrating yourself, and managing your diet while reducing fast food consumption. To enhance your physical health, you should be patient. You must have faith in yourself and take one step at a time in order to achieve your goals. There is no recipe for being mentally stable, because everybody is different and perceives happiness in their own way. This is the reason why you should spend your time doing things that you enjoy with people that you love. Have you noticed that people are usually considered mentally healthy if they do the following things: spend time in nature, socialize, listen to music, read books, or watch movies, but actually you do not know what goes into a person's mind, and appearances can be deceiving. Asking for help is a way of improving yourself. It is a method of accepting that you don't have to solve your problems alone, that you can trust and collaborate with people in order to reach the greatest version of yourself. For example, another way of improving your mental and spiritual health is followed by forgiveness. When you forgive a person for what they have done to you, you let yourself heal. You embrace the damage that has been done to you. You let yourself heal. You embrace the damage that has been done to you and you rise from it. You can enhance your spiritual health by connecting with the universe. You can do this by meditating, by spending time in nature, embracing the beauty that surrounds you. Therefore, you can enhance your spiritual health with multiple meditation rituals, by exercising yoga in a peaceful environment, and by doing some breathing exercises.
Thank you. Thank you. It was very helpful, really, especially that forgiveness heals, for example. Interesting.
Okay, thank you.
If I may,
forgiveness heals. That's okay. Thank you.
May I say?
Can continue. Okay, somebody else.
Yes, please, Ms. Mainuța.
Bianca had a nice message to all of us. It was really, really, really important. As if we feel healthy, this is what rises our self-esteem, that rises our well-being. But that does not grant or comes down from the sky. We have to do some efforts to ensure that we live a healthy life. I have to go, but I wrote in chat a few words for everyone. For a healthier you have to drink plenty of water, choose nutritious, healthy, plant-based food, less meat, get enough sleep, do regular exercise, avoid news overdose, reduce the screen time, and be mindful. Being mindful doesn't mean that you have to master the meditation. This technique is not very easy at the first sight for most of us, but stop to smell a rose, for example. However you do it, studies show that mindfulness slashes stress, but the stress, the chronic stress, it's on the base of the all diseases of this world, except the infectious one, of course, relieves pain and improves your mood. And scientists know why, because now they say that a nice technique of mindfulness changes parts of our brain that relate to the emotions, to learning and memory, especially for the young people. Try to improve, to import mindfulness in your everyday life. Thank you all for addressing this important issue. And most of all, I wish all of you stay safe, be positive and stay negative as for COVID. Thank you very much. I have to go. Thank you.
Thank you. Thank you, Ms. Mainuța. Can we hear some opinions from Ukraine and Moldova, please?
I think we have from Ukraine.
Hello.
Is there anybody from Ukraine who could say something about their definition?
If we talk about health and about our daily life and how it should be better at healthy living, well, they already have told everything. But if there's nothing else to add, we should stay healthy. We should eat healthy. We should have physical activities in our life. We should go out. We should enjoy life basically, and stop spending a lot of time on our computers. And since we are online these days, we have to open our PCs and stay on, be in front of the screen most of the time. However, we can still make time to go out and do some exercises.
I would like to add something.
Sure.
I'm Marine Kaur from Ukraine, and I would like to say that whatever makes you happy, just go and do it. Because if you like writing, go write something. If you like drawing, go draw. Because in the end, no matter how many exercises you have done or how hygienic you are, if you're not happy from within, then what's the point of it? So do whatever makes you happy. Go outside, run, jog, whatever makes you happy, or call your friends and play football with them. So it's not all, being healthy is not all about physical exercises or being hygienic. It's all about being happy from within. Thank you.
It matters really. I remembered once saying one adage that we studied. It's better to add life to your ears than to add ears to your life, maybe. Can you say so?
Yeah, I agree.
Okay, thank you very much.
So much. And now that we are all students and teachers, I think we can take the next question more personally. How can educational institutions promote healthy living for young people, in your opinion?
Yes, we are all students, teachers here. How can we promote healthy living?
Can I start?
Yes, please.
I think that educational institutions might ask doctors, general practitioners to come to schools and have discussions with children of different ages, ask them about the lifestyle they have now, how it makes them feel, and give them certain recommendations in the future to follow. Also, our government can cooperate with our Moldovan schools, I'm talking about Moldova, and give the students once a week or once in 2 weeks, I don't know, fruits and vegetables, because Moldova is an agricultural country. We had this practice in the past. It happened only once, but it was made not out of altruism, but out of the problem that we had, that Moldova couldn't sell the vegetables. So I think that we should kind of implement this technique again, if it's possible. It's something good, I think.
Thank you. Thank you, Irina. Anybody else?
Something? Can I add something?
Yes, please.
So, in my opinion, some different kinds of discussions or meetings have to be organized, but not as lectures, boring, maybe as games or something which is funny, so the students can easily get the importance of health and how to be healthy. And also, films are very good for this case, because, for example, in Bulgaria a few years ago, a very interesting film was made. It's a real story about a girl who has drug addictions, and it's very interesting because we can see the reality, we can see the difficulties of these girls, the grief of her family. And also, I want to say something very important. These institutions have to be very careful, because young people, we hate the word no. When we hear no, we do the opposite. So they have to find a way to change our mind, but without telling it directly.
Without prohibitions, without saying no. Okay.
May I also add something?
Of course.
I think that having visual information may be helpful, such as posters that show the consequences of having bad habits that damage health. Also, I believe that it would be a great idea if the PE teachers were experts in the nutrition field, because students could benefit a lot from the guiding through the process of eating healthy. It is not only about teaching students what to eat. With the technology that we have, PE teachers could easily recommend some workouts on YouTube for the children who want to get in a better shape. Because I was talking about nutrition and eating healthy, I would say that canteens must have good quality food, not only fries and pasta, but also salads and more vegetables. The school administration may also place some posters with information about different types of dishes and how to combine food in a healthy way. Not only the physical health is important, but also the mental health. I think that employing a psychologist would be beneficial for the teenagers. The psychologist should have therapy sessions with the students in order to help them go through the challenges of life. Maybe introducing to the schedule a mindfulness hour would be helpful. Last year at my school, we had 1 hour like this where we used to play some interesting games involving meditation that helped us relax and clear our minds.
Many thanks, Antonia. Can we please hear someone from Ukraine?
Sure, go ahead.
Okay. So regarding from our school, we have this thing in every class. As I understand, we have it. It's a class hour. I don't know if it is in other schools as well. I personally know about our school. It's a lesson, like practically a lesson that happens once or twice a week, in which the teacher and the class communicate together to become closer at one point and talk about serious stuff with positivity. Like, for example, if a teacher tells you about a problem, you might not take it serious because you might think it's a teacher, that person is nothing to me and stuff. But when your friends and your loved ones are involved in the talking, in the communication, it might actually affect and actually make them think about it more. So one of the things that is done in our school is such topics are talked with classes on the lessons. And I agree about the canteen situation, about the healthy food. Yeah.
Thank you. If you are to summarize, so interactive games are of use, are of help, and visual information and peer teaching. Peer teaching helps a lot. All right, more than teachers. Okay, thank you.
Thank you.
We continue with something which is very authentic, up to date. Could you please tell us your opinion about COVID-19 pandemic? How does it affect our mental health?
Can I start?
We have mentioned a little bit about it, but...
I'm Maria and I'm from Ukraine. And I think the early stages of the pandemic and the ensuing lockdown were hard on all of us in different ways. Isolation, joblessness, childcare, and many other challenges severely affected the mental well-being of many people. Notably suffer from it teenagers who haven't got to develop evolved worldview. During lockdown, we sit at home and communicate mostly with people who are older than us, our family. Without noticing this, they don't allow us to have our own opinion and kill the personality in us. That is why it's too important to communicate with people your age. Plus, teenagers haven't got active rest. It is too bad for us. Our body doesn't develop correctly. Likewise, people acquire new insecurity. They see just beautiful picture in social media. They don't expect about Photoshop or filtering that photo. They see just perfect face and body. That is why I think society need to communicate face to face. Item we spend very little time outside. It's also an effect to our mental health. We see world just in video, which hasn't been filmed by us. We closed in our house. It influences on our mind. That is why I suppose that pandemic is so bad thing for our mental health.
Thank you. Active rest for our mind. Okay, thank you. Anybody else?
Yeah, can I add something?
Yes, Roxana.
Okay. So in my opinion, I think that sitting in front of a screen 24/7 has had a highly negative impact on our social life, and not only. The pandemic has limited all the opportunities of socialization, which include meeting new people, making strong relationships and friendship bonds with others, and even going to school. The technology, which is ubiquitous nowadays, is not a reliable source, in my opinion, and it causes a lot of stress among young people and elder people, for whom the transition to online classes and the online world in general was a big setback in their lives.
Thank you very much for reminding us of that.
Can I add?
Yes, please.
Okay, I think that the pandemic definitely has had a big impact on people and their mental state. The fact that we were asked to stay home, make sure not to catch any coronavirus bacteria, has made me personally more anxious. Since the beginning of pandemic, I started worrying more than usual. I became more careful with who I speak, who I talk to, who I touch, who I interact with, how I wash my hands even. Mental state was definitely affected in all people, not just in me, I'm sure. They might not notice it now, but I think that it's just a matter of time. Yes, thank you.
Be positive, huh? It's a matter of time.
Yeah.
Anybody else?
May I continue?
Yes, please.
Each one of us was affected by the pandemic in some way, and especially because we were not able to socialize, which led to people having insecurities, fear, and lack of confidence. At first, I thought it was the best thing that ever happened to me because I was able to spend more time with my family, playing board games and cooking. I spent my time doing things that I enjoyed. I felt like nothing could affect me, as I didn't have to leave my house at all. The only thing that kept me informed was the news. Hundreds, then thousands of people were dying while I was watching my favorite TV shows, and I couldn't do anything to help them. My heart started breaking when I saw the state administration playing with the lives of the lower class. One week, they had a steady job, and the next week, they were dying of hunger. It is not fair at all. Thousands of families went through unimaginable pain. Imagine preparing your whole life for a job, having no other option, and the government says that everything in your field should close. That is when feeling useless turns into depression and anxiety. People start hiding themselves from the outside world because they think everyone hates them. It is known that the lack of social connection heightens health risks as much as smoking 3/4 of a pack of cigarettes every day. Besides this, the educational system suffered a lot from the lockdown. The connection between teachers and students was lost, as the online school is boring and tiring for both sides. The teachers started being less invested in making the hours interesting and funny, while the students lost their motivation to do their homework, study, pay attention to what the teacher is saying, and even write notes in their notebooks. It is a tragic period for all the generations. From my experience, the past school year was simply a waste of time and energy. I stressed a lot because I wasn't able to understand anything in the majority of subjects, and the tests were for nothing. Everyone was cheating.
Okay, thank you so much.
I would like to add something.
Yes.
I think that being away from people we love, our friends, or maybe our grandparents, it's pretty difficult. It's stressing, and slowly we are all forgetting face-to-face interaction. And I think that it's increasing stress and anxiety in young people because we all are just sitting on Instagram and other social media apps, just waiting for likes. And that's pretty stressing because you're sitting and you just post something and then you don't have, because you don't have anything else to do. You're just with your phone and your computer in your room. And the other thing is that we don't express everything on social media. We just reply with a 2-letter word called okay. And we don't show everything. And that's the reason why we are forgetting face-to-face interaction. Another problem is the financial status. Because of healthcare, not everyone is getting proper healthcare, and because of the money, because we are all sitting at our homes, not everyone can do their work from home, and people are having financial problems. So this pandemic is greatly affecting our mental health and our financial status as well. Thank you.
Thank you. I think we can continue with the fourth question, or if someone from Bulgaria wants to add something.
Maybe they will speak later. Okay, thank you for your heart. Thank you for sharing that information with us.
Yes. And the last question is, in today's world, do you think people care less about their health Despite all the advancements in medicine and technology, why do you think some diseases occur more frequently than before?
Can I start?
Is it because of us?
Can you hear? Hello?
Yes.
I'm going to start with, in my opinion, it's not that diseases are occurring more frequently. That's not entirely true in my opinion, but because these medical and technological advancements have occurred, we have become more able to track and find diseases and even new kinds of diseases. So in my opinion, it's not really common diseases or any other kind of diseases being more frequent, but we just got better at finding it. If anyone else wants to add something.
Yeah, I would like to add to your answer. Can I?
Sure.
Okay. I completely agree with the girl. I support her opinion. I think that people in modern world started taking care more about their health, about their well-being in general than in the past. It doesn't apply to all groups of people though, because in some countries, the poor is getting only poorer and the rich is getting only richer. Not all people have access to healthcare. Some diseases started occurring more frequently than in the past. I think it happens because of this anti-vaccine movement that started happening during coronavirus outbreak. Parents and people in general, they are unwilling to give themselves vaccines and their children vaccines because they think that they are, can I say, testing rats? I hope that it doesn't sound rude, but that's how it is. We not know all the consequences of this one vaccine, but there are so many vaccines in this world now of coronavirus. People are just unwilling to get themselves vaccinated, and they are unwilling to get vaccines about other diseases that could possibly save them from other diseases. Thank you.
Thank you. Anybody else about that question?
Yeah, I would also like to talk about this topic. So I strongly believe that today's society is dictated by the social media. We practically grew up surrounded by the media. We spend our days scrolling through the endless content posted on it, enjoying every piece of information that has been gathered in our minds. I believe that media is everywhere and nowhere at the same time because it is all around us and it is a great factor that defines us as a person. Therefore, I think I would like to talk about an existential problem that has been damaging the young audience. The issue is the need of looking a certain way. We all know that social media mostly promotes a certain way of looking. Being not skinny or not too fat, you must have a tiny waist, strong legs, no belly fat. You mustn't have cellulite or stretch marks on your body. These are the standards that a young woman must follow in order to be accepted and liked on social media. My answer to the following question, do you think that people care less about their health, is that people do care about their physical appearance due to the constant need of fitting the pretty category, but they tend to neglect their mental health. I think that today's society is more informed. They have a basic knowledge about medical advancements and medicine in general. Due to this reason, some people prefer to diagnose, to treat themselves without having a professional experience in the medical field. They think that because of the information gathered from the internet, they are able to treat and administer pills without going to a real doctor. In my opinion, undocumented people that think they know it all are the reason why some diseases occur more frequently than before.
Okay. Thank you.
Anyone from Ukraine?
All right. We can continue. So Liana has different approach. Irina also explained her point of view, and Bianca from Romania about the social effect on our mental health, how it shapes us. And here, Benjamin Franklin has one saying, interesting, maybe useful to all of us. Let's read it. For those who want to be healthy and wealthy and wise, it's enough to go to bed early and to rise early, maybe. Okay, thank you all for your comments. This is what Benjamin Franklin thinks. Before we continue to the last part, to the third part, we would like to proudly announce that this year our school, Druzhba Schools, have been entitled as innovative schools because of their approach and contribution to the environment. That's why in the last part, we decided to focus our attention on the impact of climate change on our health. Here we have 3 questions. Maybe we should present them all together. So what is the impact? What are the impacts of climate change on our health?
Can I start again?
And we can take all the questions. Actually, I think we will answer them together, or we should discuss them separately.
Can I start with the first question?
Yes,
what the impacts are?
Okay.
In my opinion, or I think this is more of a fact than an opinion because I read about this, climate change contributes with greenhouse gases and warming the climate. While this is not always a bad thing, like preventing more winter deaths, it has its bad side effects greatly outweigh the good parts of climate change. So because of these increased heat, these increased temperatures, people are more likely to suffer from cardiovascular disease, and also because there's a hole in the ozone layer, because of, again, climate change, people are more likely to suffer from skin cancer. So these are 2 impacts that climate change has on human health.
Okay, can I continue?
Yes, the other impacts.
Okay, so I would like to start with an introduction to climate and climate change, and then answer the questions.
All right.
Like I have them like under the form of an essay, let's say. Okay,
under the form of?
An essay, let's say, like kind of. Okay, so climate is an omnipresent element and it is impossible to avoid. It was and still is an essential link during the evolution of not only human beings, but also the entire world. And still, humans are afraid of climate. And rightfully so, since nature from time to time gives us lessons as a way to get revenge, throwing us in the way of disasters and dangerous situations that have us the lead cause, us, the species that has inhabited and worsened the state of the planet for millions of years, humans. Climate change has been a problem for quite some time now. Though some people, such as Nobel laureate and New York Times columnist Paul Krugman, Harvard Global Health Institute director, and Katie Lee professor of environmental health policy, Ashish Jha, Barbara Fisher of the European Network Association Climate Group, and actor Leonardo DiCaprio, among others, have tried to raise awareness to this problem, I feel like only recently we have started realizing how important it actually is. Quoting Harvard speaking on climate change, quote, "Climate change is one of the most complicated and challenging problems the world has ever faced. It is a global problem and one that requires global action to manage the impacts and minimize the risks," unquote. And even now, far too many people are still doing nothing about the situation that is already becoming life-threatening. Firstly, climate change increases the appearance of more violent weather phenomena like drought, fires, flooding from rivers and lakes, and so much more. These directly affect the well-being of humans, their health, and the way they live their lives overall. Though the wildfire is a part of nature, playing a key role in shaping ecosystems by serving as an agent of renewal and change, fire is also deadly. It destroys homes and wildlife habitat and timber, thus in the long run affecting human health. Also, there is little doubt about the effects of drought events on human health in the present climate. Drought affects the environment in many different ways. Plants and animals depend on water, just like people. When a drought occurs, their food supply can shrink and their habitat can be damaged. And let's not forget the fact that drought can cause an increase in disease in wildlife animals, also because of reduced food and water supplies. Since humans also, like in the case of fires, need a proper environment to grow and take care of their health, plus the fact that they need food and water to survive, drought directly affects people's lives. The same goes for floods caused by rivers and lakes overflowing. Moreover, it is estimated that more than 350 million people could be exposed to deadly heat levels by 2050, with a rise in temperature of 2 degrees Celsius. Another 8% of the world's population could be affected by water shortages compared to the current situation. In the case of the death of animals and plant species, the health of humans is yet again affected. We all live in a chain, in an endless hoop. This chain makes sure that we all coexist on this planet, that with the help of each and every being, we are all able to live good and healthy lives. We need others in order to live. Furthermore, health is not only physical, but also mental. According to a study made by scientists at the University of Arizona, people who love animals, plants, and nature overall face the highest level of stress and depression, hence affecting their mental health. Secondly, as for who is at risk, as already estimated for heat waves, the global health effects of climate change would be heterogeneous in different regions of Europe. Health and well-being are closely linked to socioeconomic factors such as income, housing, employment, education, gender, and lifestyle. Thus, the effects of climate change would affect health inequalities between and within countries and lead to unequal distribution and additional burdens to low-income groups. And for some vulnerable groups, such as children, people working outdoors, the elderly, and people already suffering from diseases. For example, current cases of heat-related mortality indicate a strong dependence on socioeconomic factors. In the case of certain effects, such as mortality related to heat or air pollution, the elderly are much more vulnerable, and other factors affecting this group may be linked to the socioeconomic situation. Thirdly, we have to respond to this somehow. The white paper, quote, adapting to climate change towards a framework for action at European level, unquote, proposes increasing the resilience of health and social systems and emphasizes the need to ensure adequate monitoring and control of the impact of climate change on health, such as epidemiologic surveillance and control of communicable diseases, also known as infectious diseases or transmissible diseases, which are illnesses that result from the infection, presence, and growth of pathogenic biological agents in an individual human or animal host, or the effects of extreme events. Priority will need to be given to the following steps: assessing vulnerability to climate change and developing strategies for adapting to health, early warning systems, education and information measures for vulnerable groups such as as well as expanding access to key health factors such as water, energy, and sanitation, and international collaboration, of course, especially with agencies and organizations such as WHO, World Health Organization, FAO, Food and Agriculture Organization, and OIE, World Organization of Animal Health. Last but not least, not everything is black or white. Every cloud has a silver lining. There's good in bad as there is bad in good. Not everything about climate change is a disaster or brings a disaster. Human health isn't always negatively affected by the change of the climate. For example, in the temperate zone, gentle winter brings a decrease in the deaths caused by cold, an extension in the period of time in which plants grow, along with the increase in precipitation, which brings benefits to agriculture and food production, as well as gardening and other outdoor activities. And these are just two examples. So, in conclusion, humans are entirely at fault for everything that involves climate change, or at least what is happening right now and is bound to happen in the future. Of course, that does not mean that there is nothing that can be done. Believe me, there is plenty. As my father would often say, the first step is always the hardest. The rest just follows. Thank you.
Thank you. Thank you for putting your mind into words and speaking your heart. It was a nice summary, actually, of what we have said so far.
Still, we'd like some more opinions if someone has to say something.
Can I please add something?
Sure.
Miriam?
I'm Miriam from Ukraine, and I can't turn my camera on now because of some technical problems. I'm so sorry. In the 21st century, people need to worry more and more about global warming. Over the past 130 years, global temperatures have increased by about 0.85 degrees Celsius. Sea levels are rising, glaciers are melting, and rivers are drying up. In my opinion, we must urgently pay attention to this and try to fix it. Scientists say that we have only 12 years left to stop the rise of temperature. In addition, it greatly affects on human health. It affects on clean air, safe drink water, food, and safe shelter. Also, the high temperature in the air increases the levels of ozone and other pollutants that cause various diseases of heart and lungs. Even natural disasters and fresh water supplies will be affected by global warming. The number of floods and earthquakes is growing very quickly. Climate change will affect on all population groups. Children, especially in poor countries, are among the most vulnerable to the health risk of climate change. But it will also affect on animals and plants. Due to climatic changes, the planet may lose a sort of plant and animal species by 2070. Fortunately, there are many ways to fix it. Each of us, regardless of where we live, can help to solve the problem of climate changes. For example, we can recycle waste, walk or ride a bicycle instead of using a car, unplugging unused electrical devices, and it is just a small part of what can be done. So please help our planet and yourself. Thank you.
Thank you. Thanks so much. Can we have someone from Moldova, please?
Yeah. Can I say that Sarah Brianna's speech was just so awesome? I learned so many things. You have a talent, you inspire me. I would like to say that climate change affected and still affects a person's health drastically. The change in ecology impacts our nervous and respiratory systems in our body. Increased heat affects people with asthma because it makes them harder to breathe when they are outside. Climate change causes stress, increases a risk of suffering from waterborne diseases, and in general, it affects nature, but human beings are a part of this nature, so it affects us as well. At risk are, I think, elderly people, children. Children are always at risk, and people with chronic and serious diseases, since their bodies are already fighting with the disease, and I don't think they have enough strength to fight another virus. They don't have a strong immune system, I think. Elderly people are at risk because they are elderly. The word speaks for itself. And children, I think that they will be the greatest burden of hunger and malnutrition if something bad will happen, like a crisis and other things. People need to reduce and stabilize levels of heat-trapping greenhouse gases in the atmosphere and teach their children to treat nature with a big respect. Tell them not to throw garbage on the streets, for example, a regular rule, right? The leaders should discuss this serious issue on various briefings, on various political meetings, and come up with different restrictions and prohibitions for manufacturers and their fabrics. Thank you.
Thank you so much.
Thank you.
We can hear some more opinions if someone has any.
Okay. So we continue then. It's obvious who is at risk. It's us, right? So the next, what Miriam said actually a little bit frightened me. We have left 12 years. Did she say 12 years for the climate change to affect us.
Yeah, 12,
if I'm not
12
mistaken,
years.
she gave that number. So it's really urgent and necessary to take actions. What should we do? How should we respond to that change, that climate change? The last question.
Can I say something?
Yes, of course.
In my opinion, we need to reconsider how we use energy and how we get energy, more importantly, because a thing I learned recently is that people think really negatively about using nuclear energy. And what I read is that nuclear energy is actually much better for the environment than any fossil fuels, oil, and natural gases can ever be. Yet people still associated with the nuclear accidents and the explosions that killed people and the fear of radiation leaks. But when in reality, radiation isn't that dangerous unless you're right in the exposure. And for many years, we can see this from Marie Curie. She always kept radiation material on her, and it took her quite a while to get sick and die. And now that we know that it's dangerous, we can take even better measures against these radiation dangers. So what I'm trying to say is that instead of leaving radiation energy, or nuclear energy, I should say, behind, we should, until renewable energy sources become stable and we're able to use them reliably without the power cutting out, because the energy isn't reliable from these renewable sources, we should temporarily use nuclear energy, as it's much better than fossil fuels and stuff like that. And people are, despite wanting to switch to renewable energy, they're in Germany, for example, they're making the government destroy these nuclear energy sources. Sorry. And yeah, I think we should reconsider our energy sources. That's one of the first steps, because fossil fuels, as we know, are one of the greatest contributors to climate change and greenhouse gases.
So how we use the energy and how we get the energy. Okay. About the usage of nuclear energy, there might be some different opinions, of course, but it's another matter of discussion. Okay. Thank you, Liana. Thank you very much. Anybody else about what we should do? Okay. We should be careful about the energy. All right.
It's evolved. Okay. That's it then. We would like to thank all the wonderful people who spoke and listened today. All of you taking time out of your busy personal and professional schedules means a lot to us. It was a very enjoyable and informative experience. With the help of all our gatherings, I believe that we all somehow feel the strength of being together, being related, and being connected. Thank you a lot.
Well, we really feel so. If you would like to share any comments in the end.
Thank you too.
Yeah, just to say thank you for organizing, for putting a lot of effort into making different videos, into making your children of your school engaging in this beautiful activity. Thank you very much. It was a nice, very, very good experience for me. Thank you very much.
The same for us. Thank you.
Can I say something?
Yes, something concluding.
So we heard many different opinions, and to be honest, while we were talking about health systems of the different countries, I couldn't hear anything good. Almost everybody showed the bad sides of their health systems. But do you know, I want to ask you something. Can you imagine that there are some countries in which health systems even don't exist. What I mean, for example, in Africa, some people, they don't have access to healthcare. And yeah, we have to do something. We have to improve our own health systems, but also we have to think about the other countries, the other poor countries, and we have to make this world more beautiful for everybody. And I hope we will do it, because these kind of meetings, they have to motivate us. They have to make us thinking about the problem. And when we start thinking about the problem, we will find a solution.
Yeah, I completely agree with you. I think that some of us might become doctors in the future, so we may volunteer in other countries that you have listed to help those people that not have the access to healthcare systems at all.
Yeah, there is something that each one of us can do, really.
I think that's nice.
Thank you all very much. Hope to see you again. Thank you for being together.
Have a beautiful evening.
Goodbye, everyone.
Thanks a lot.
Thank you.
Goodbye.
Goodbye. Have a great day.
Goodbye.
Bye.
Bye. It's difficult to leave the people and leave what it is nice.